Okay, we're here today with Robert, and Robert is about to start his treatment with Dr. Davis. So, Robert, tell me about those knees. How long have they been giving you problems?
Well, it all started in June. There's a very definite starting point, and progressively got worse. And I got stiff. I can't feel my hands. My feet are numb. My legs are numb, and my balance is off. But
So, tell me, what do you think is causing this problem?
it's definitely the neuropathy
Okay,
that's doing
that's affecting the knees?
it. Yes, ma'am.
Okay. So, was there any injury that you had to the knees or anything?
No, it just, I don't know why, but it just started, and
Okay.
it's
So, what is an average day like for you with those knees? We just want to talk about just the knees.
limited walking,
Okay.
no driving. I do as much as I can, but it's all very limited. It's,
And you have to walk with a cane, correct?
yes, ma'am,
Okay. It's affecting your balance.
definitely.
Definitely affecting your balance.
Yeah,
So, what would you say your pain level is in those knees just today? 0 being no pain and 10 being unbearable.
an 8, a
Okay.
solid 8.
And what causes you the most pain? Is it going from sitting to standing? Is it squatting down? Which one causes you the most difficult?
You name it, all of it. Just sitting in the chair causes pain because when you're froze up and then you first try to move, standing up, oh,
I see. So when you're sitting for long periods of time, it kind of freezes up, everything tightens up, and then till you get moving.
yes, ma'am.
I
Standing
see.
up, you have to stand there for a while and just try to move and get everything moving again.
Right, I see. Is there anything that you do that makes it feel better?
I go to the hot tub.
Okay.
Uh, I do take pain medicine, but I've been on that for years. So, not really. I
Okay.
try to exercise. I try to walk. I do my exercises,
Right.
and yeah, trying to stretch,
Okay.
stretching your calves, stretching your.
That's very important.
Yes.
And you're going to find that out.
Yes, yes.
All right, Robert. I'm going to have you just do a couple things for me.
Okey-doke.
The first thing I want you to do is just stand up for me. If you just go from sitting to standing. Okay. Now tell me, where did you feel that? Where,
In my knees,
where at? Could you point to where you're feeling it in your knees?
right.
Not above, below, inside,
Right
outside?
through the joint, right there.
Okay.
Both
All right.
sides.
Both sides. Okay. So standing right there, I want you to put your arms out in front and try to do a squat. Try to just go down as far as you can and then slowly come back up. Okay. Same spot. I can see it's really throwing your balance off when you
Yeah.
do that.
Yep.
Okay. All right. I'm going to have you go up and down the stairs for me. There you go, onto that railing. All right. Now we're going to go back up those stairs. Now, where were you feeling that discomfort going up and down the stairs?
In my thighs, in my knees,
Okay.
and
What?
my feet. I can feel my feet hitting the ground,
Right.
but I really can't feel.
So you don't know if the ground's there or not. So you can
Right.
you can hear
That's
it.
why I walk stiff a lot, because if you can't feel your feet, it's tough.
Right, right.
So
Was it more difficult going up the stairs or coming down?
I think coming up.
Coming up the stairs was more difficult? Okay. All right. So you ready to get started?
Yes, ma'am.
Let's get this party started.
Deep breath, Robert, and up. 1, 2, keep going. 3, 4. Deep breath. Press down with your heels. Go. 1, 2, 3. Keep pressing. 4.
Look at you.
Sure.
Good job, Robert. How's it feel?
Use your hand
Now
against
look
the
at you
wall.
dancing the jig. All right.
Man, they're loose.
Look at you
Good job,
walk.
Robert.
Wow. How's it feel?
Oh, it feels excellent.
What changes do you notice?
Definitely.
Good, Robert.
My knees are like unlocked now.
Nice.
When I got, they
You're
wouldn't-
marching.
They wouldn't bend like that. I walked stiff-legged.
Yes, when you first came in.
Yep. And I get too excited.
You feel good?
Oh yeah,
You consider this positive?
definitely.
And then can you just give me a little mention about how it feels to work outside of your insurance?
Well, I gotta do what I gotta do, and if it takes this doctor who operates that way, that's okay.
Good. I'm glad. So glad to see you moving around so smoothly.
Nobody else has offered me help and hope like this guy has. Yeah.
It's a pretty good guy, I think.
Well, like I said, everybody else said, "Oh, what you have is weird." Yeah, it's weird, all right, but where are some answers? Right here.
Right here. Yes,
Right
sir.
here.
Now,
Okay.
Robert, I'm going to ask you first to go ahead and do the sit. How did that feel from before?
Definitely better.
Good. And now stand. Sit to stand. That was pretty smooth. How did you feel?
Good.
Good. All right. And now, what did you stick your hands out before and squat? Be very careful. All right. Any pain?
No.
Okay. Now we're going to try the real test. Here we go with the stairs.
All right.
Oh, how did that? That's pretty exciting. Now
Yeah,
try to
it
go
is.
back up.
Okay.
Remember to hang on if you need to.
That's my normal way, anyhow. Yeah.
That's amazing.
It is wonderful, isn't it?
Feels good, huh?
Yes.
You
ma'am.
consider all these positive?
Yes.
Great news. And now we're going to finish some therapies.
Okay.